the first of the 2-week series, and we are going to be discussing Black health during the coronavirus pandemic. We actually have partnered with the Commemoration Committee for the Black Panther Party, as they will be hosting this today for us all. And so I am Jada Curry, Director of Programs here at both sides of the conversation, and some of the folks joining us today that you'll be hearing from soon will be introduced in just a minute. But for your both sides of the conversation staff, I have.
I'm Rico Hamilton, co-founder of Both Sides of the Conversation.
And I am John Henry, co-founder of Both Sides of the Conversation.
All right, and while we want to get started as soon as possible, we just want to remind you to share this on Facebook, start a watch party, if you will, share it to any other social media platforms that you feel that this conversation should be reached. So while we give you a few minutes to do that, John, do you want to go over our standard procedures?
Yes. Both sides of the conversation is providing a safe and honest space for open conversation. Please be respectful to that. Be respectful of the panelists and the hosts and our participants. Healthy debates and conversations are encouraged. Please don't personalize anything with anyone. No name calling, bullying, trolling, or shaming will not be allowed. Your perspective is yours. It is not a prescription. But please respect people's perspective. You don't have to agree, but you must show respect.
All right, and I'll just add in there that so the rules of engagement on Zoom, if you are joining us in our Zoom webinar right now, we are glad that you are here, number one. Number two, if you would like to come up as a panelist during the Q&A section of today, you just need to raise your hand so that you can ask our lovely panelists a question. We also will be watching the Facebook Live and looking at the comments that are there so that we can maybe hopefully answer your question. And with that being said, I am actually going to hand it over to Eseibio. He's going to introduce himself, the organization he's a part of, and our special guest speakers for the day. So Eseibio, I'm going to go ahead and unmute your mic so you can jump in and do that.
All right. All power to the people. Hello, everybody. My name is Eseibio Halliday. I'm a hip hop artist from Oakland, California, and a member of the Commemoration Committee for the Black Panther Party and a Black Panther Party legacy keeper. And what we do is we commemorate or continue the legacy of the Black Panther Party. But in the Black Panther Party, we got something that we say AP to the P, all power to the people. So when I say AP to the P, I'm gonna need you to say all power to the people. So AP to the P, all power to the people. AP to the P, all power to the people, all power to the people. So act like you know, man, it's the platform, it's the 10-point program, the freedom, employment, the robbery, the housing, the education, healthcare, police brutality. Plus, we want to end all wars of aggression. We want a fair trial by jury of peers. We want land, bread, housing, clothing, education, justice, and peace, and people's control of modern technology. Shit, that was a 10-point program. But we are here today to talk about point number 6 of the 10-point platform and how it relates to the COVID-19 pandemic. Point number 6 of the 10-point platform says we want completely free healthcare for all Black and oppressed people. We believe that the government must provide free of charge for the people health facilities, which will not only treat our illnesses, most of which have come about as a result of our oppression, but will also develop preventive medical programs to guarantee our survival. Our program is going to go as follows. I'm going to bring up my comrade Jabari Shaw, and he's going to give a PowerPoint presentation and go more in depth on the Black Panther Party free healthcare programs, the sickle cell anemia program, the free ambulance programs, and all of that stuff. And then we're going to show a 10-minute documentary about the Black Panther Party free healthcare programs. And then after that, we're going to turn it over to our special guest speakers, Dr. Saturu Ned and Professor Steve McCutchen, two original Black Panther Party members, alumni, and they're going to speak for a minute, and then they're going to have a question and answer session. So with that, I'd like to say all power to the people, and I'm going to turn it over to my comrade, Jabari Shaw.
All power to the people. How y'all doing today? Can you hear me?
Got you. We got you.
Okay. Make sure I'm in. Your sister got me prompted with the slides. That's beautiful. Thank you. Yeah, man. Bismillahirrahmanirrahim. All power to the people, man. So talk about the Black Panther Party and their programs. First of all, we have to understand that well, certain people, body and soul. Dr. Huey P. Newton, Minister of Defense of the Black Panther Party, in his autobiography, Revolutionary Suicide, said that the Black Panther Party was started on the continent of Africa when the first of us resisted colonialization. So we have to think about the impacts is long lasting. It started way back in Africa. You know what I mean? And I know when you look at this picture, you're probably thinking nobody's social distancing, but you know what I'm saying? We were subjected to diseases and rape and abuse and things that, you know, we had never seen before in this country. Actually, you know, sickle cell was a mutation from malaria for people to protect themselves against malaria. So, you know what I mean, 98% of the people who was affected with sickle cell anemia in America were Black, you know, so it goes way back to the transatlantic slave trade. But we held on to our traditions deeply, even though we were slaves and used as property. They knew us as witch doctors and medicine men for some of the better names that they called us. You know, but we cared for whipped slaves, you know, was midwives to the slave masters. You know, they called us bed wenches. When they had fevers, they would lay their feet on Black people to heal themselves. And so, but we know back in Africa, you know, we had already diagnosed diabetes. We had had lobotomy surgeries, you know what I mean? Yeah, man, you know what I'm saying? We was deep into medicine and everything before our colonialization. And so, and they used us even more than we would ourselves. They would call a Black doctor witch doctor before they would call the so-called medical physicians. It wasn't until 1845 that we got our first Black nurse, you know, and with the first Black nurse, you know, they gave a sense of hope for Black women in America, like something that they could be more than a servant or someone that cleans up the house and fold up clothes and watch over kids. So at this time, the medical, you know, people really got into the medical field or really wanted to get into the medical field. It was a lot of snags though at the time. You know, they weren't taken, but I think only 2 women a year or so. You know what I mean? Oh, I'm sorry, we still on the first slide. Can we yeah, fast forward a little bit to the 4th slide. I want to talk about back at 1845, James Lynn. So before while we were still the next slide. So while we were still, you know, in slavery or whatever, they used our medical position was only based on how good we could work. You know what I'm saying? So they were breeding women at young ages. We suffered from vitamin D deficiency, and they was having babies and was busting their pelvis and causing a disease called vaginal. Oh, I'm sorry, I can't say it. But this so-called Dr. James Morrison Sims started butchering on women and working on them without anesthesia or whatnot to you know, to try to figure out a cure for this because it was hurting white women, but he couldn't just practice on them. And it's funny that, you know, he did this legally to people and then he got, he lifted to the highest office of his profession. He even worked for the Queen of England as her personal physician. In 19, let's get to the next one. So in 1890 to 1966, I mean, it opened and closed a couple times since then. Providence Hospital was born. Daniel Hill Williams, who was a medical physician, a surgeon, I'm sorry, and he wasn't able to work in his field, you know, so he was only working in people, he was relegated to just working in people's houses. And a sister named Emma Reynolds, who was denied getting into the nursing field or into nursing schools, approached him asking him to you know, basically trainer. So in his house, he started training nurses, and then eventually they made it into a whole hospital in Chicago, Illinois. By 1893, he did the first open heart surgery in that hospital right in Chicago. Here we go to the next slide. The after that, he traveled to other places to train nurses and to start programs like that. The most notable was at the Tuskegee Institute. In 1914, Booker T. Washington gave his famous speech, which led to Negro Health Week, and the nurses would, you know, take the streets or whatever. You can see a caption of them meeting there. By 1920, Henrietta Vinton Davis, a member of the UNIA, Marcus Garvey's group, started the Black Cross Nurses in Philadelphia, and it spread, you know, like wildfire. The organization dwindled around 27 after the deportation of Marcus Garvey, but they still aided in giving education in the community and helping with medical help. It was a real big problem with the medical segregation era. You know, the most popular case of medical segregation was Charles Drew, who actually discovered plasma while on the trip to Tuskegee Institute to give a lecture. He got into a car crash and went to a hospital, and they refused to give him a blood transplant in the White Hospital, and he died after being transported to an all Negro hospital. And, I point this stuff out because I know we talking about the Black Panther Party and their health program, but we have to recognize and realize the situations that caused the Panthers to call for this. You know, the medical malpractice, us not being able to go to hospitals, and even when we went to hospitals, you know, we were you know, put in the basements. We had to, you know, they was packed full, and so. Like in the situation with Providence Hospital, it actually closed later on because of Richard Nixon with his HMOs. And so if you had some kind of medical insurance, you couldn't use them at the Black hospitals. And so this set the stage for Fred Hampton to say that we need a medical health care center. You know what I mean? Can we go to the next slide? We look at the 16th Street church bombing. You know, and I wanted to note that Angela Davis actually went to school with some of these girls. But, you know, they hauled the girls up and then the survivors was treated in the basement of the hospital. You know, they wasn't getting real treatment. So not only did segregation and oppression hit us in the streets from white races, it hit us from in healthcare centers when we was trying to get treated. Can we go to the next slide? Even with the sit-in movement, you had Black people talk about nonviolence and sitting in to be included in white society. And they was only attacked by dogs and beaten. So my question was, with all of this was, okay, where did they get treated at for these busted heads, these dog bites and everything? Go to the next stage. In 1964, it was a group that started called the Medical Committee for Human Rights. They volunteered to get medical assistance to the Bloody Summer, what they call Freedom Summer in Mississippi that year. I point this out because, you know what I mean, after the party started, you know, a lot of members of SNCC came on to the party. You know, we had a Stokely Carmichael, we had an Imam Jamil Alameen, and others who came straight from that movement into the Black Panther Party. We go to the next one. Yeah, so after the killing of Malcolm X and the riots and all of that, was birthed the Black Panther Party for self-defense. And that the Black Panther Party created the 10-point platform. We go to the next one. Like Malcolm X, Brother Huey said, we need to make it plain for the people. He said, we want freedom. We want the power to determine the destiny of our own Black community. We want full employment for our people. We want to end the robbery of the white man of the Black community. We want decent housing, fit for shelter human beings. We want education for our people that exposes the true nature of this decadent American society. We want education that teaches us our true history and our role in present day society. We want all Black men exempt from military service. We want an immediate end to police brutality and murder of Black people. We want freedom of all Black men held at federal, state, county, and city prisons and jails. We want all Black people, when brought to trial, be tried by a court and a jury of their peer group. And finally, we want land, bread, housing, education, clothing, justice, and peace. This was the original 10-point platform. It was reformed in 1972 to include others and to change point 6 into free medical health care, for free health care for all. Black Panthers started a lot of alliances and realized that it was a class struggle and not just, a Black struggle, that all poor and oppressed people were being victimized, and in understanding that, they even updated their platform. And I think that was one of the most honorable things of the party, to show that they were not stagnated, and where they began in their humble beginnings, that they were always willing to evolve for the needs of the people, to serve the people. Can we go to the next one? From the inception of the Black Panther Party, their primary focus was the health and the well-being of the Black community. The first protest we know of was them going out for a stop sign. Kids was getting ran over in the streets in Berkeley near Grove Street College, where they went to school at. And some people ran into the school like, y'all talk all that stuff, what y'all gonna do now? And they actually put their bodies on the line, being human stop signs and walking people across the streets, and did shifts and everything. You think about, healthcare, but it's imminent death that we face too. Like the police patrols. If somebody was being victimized by the police, they would observe them, at a distance, and they would watch them, and they would even follow the police to the police station and bail some of these people out. These people who go to jail was the breadwinners of their family, and if they, went to jail, then who was gonna feed the kids? Who was gonna watch over them? So they had to think about things like that. And come the free breakfast program. Sisters in there some was concerned with just feeding their own kids at first, and then others later on, the big community started coming in. They seen the need of it. Some had the understanding that, with malnutrition and not being able to eat, you couldn't even really understand what the teacher was talking about. So, and it's go deep into medical health, because if you're not eating right, then your body starts to deteriorate. They had a program called Squeeze the Slumlord, where people lived in ratchet conditions, you know what I'm saying? The same conditions that Booker T talked about living in Up From Slavery, where it was holes and cracks in the walls. I think about a video with the murder of Fred Hampton, and they said that they had a barricade to keep the police out. And then when Mama Akua came to speak, she said that barricade was to keep the rats out. You know what I mean? So rats and rodents was running through people's apartments. The landlords didn't care nothing about it. Kids was going to the hospital for rodent bites, for insects in their ear, and stuff like that. So to think, you know what I mean, that stuff that the white community didn't have to face. And sometimes you'd be even too embarrassed to go to the hospital because it's a roach in your ear. And then you have to sit there for 5 or 6 hours in the waiting room before you really even get any help. And they started another program called SAFE. And this was for the senior citizens. At the time, senior citizens would go to cash their checks, and people would beat them over the head, take their money, whatever, or they were old and they couldn't really move around like they needed to. So the Panthers figured out a way to bust them to cash their checks, to take them to go grocery shopping and to pick up their medications and to make sure they got home, safely. This was later on adapted by paratransit, and this is basically what paratransit does right now. I point out all of these because, we talk about the health of the community, you know what I mean? It's overall health too. It's just not diseases. It's the conditions that create the diseases. If you're hungry, you know what I'm saying? You're more liable to get sick. You know what I'm saying? If your house is cold, man, for real. Can we go to the next one? All right, 1969, Fred Hampton, deputy chairman. So this is 1969. Chairman Fred Hampton said, first we have free breakfast, then we have free buses, then we have free medical care, And then we had Freedom. So he was well involved with his time, you know what I mean? He hooked up with the Young Lords in that area, and they had a, a, a a coalition of different, you know what I'm saying, races of people, whatnot, different people who was concerned with their medical care and oppression in the police. Um, I want to note that the first medical clinic was in 1969 in Chicago. It was named after Conrad Jake Winters, who was killed in the police raid at the headquarters. At this time, Fred Hampton was locked up in jail for, I believe it was a $72 ice cream burglary or whatnot. And so while he was in jail, the police thought that they could raid the headquarters and try to get any information to try to hold against Fred Hampton, and that's when the shootout ensued. Later on, Fred Hampton was released in that same year. Him and Mark Clark was assassinated in Fred Hampton's home. But this sparked it up for the Panthers. Yeah, thank you. It sparked it up for the Panthers, you know, and their programs. At this time, Hoover said that the free breakfast program is the greatest threat to national security. And somebody said, free grits? You know what I mean? What was it with free grits? But, you know, from my understanding that if you had these kids coming through every day, you walking them to school, you feeding them, you get to understand they underlying problems, what they really going through, and you be able to serve their needs. And once you be able to serve their needs, then you can, you know what I mean, help motivate them to go into the right way. So Hoover called his attack on 1969 of the Black Panther Party. Can we go to the next slide? So by 1970, the Black Panther Party for Self-Defense ordered that everybody, that all chapters have a free medical clinic. In this, he said 19 delegates are members to China to go study Eastern alternative medicines like acupuncture therapy and other things. In this picture right here, I don't know everybody, but among them is Dr. Tobert Smalls and Dr. Mutulu Shakur. Can we go to the next one? Dr. Tobert Smalls, who is to the right of the page, this was actually my doctor up until last year. This was a Panther doctor. And he never joined the Black Panther Party, you know, formally, but he was a Panther at heart. He was at every event and still comes to every event that I know of. What he did was he went to his colleagues and doctor friends that he knew, and he talked them into coming to volunteer their time, you know, at the free clinics or whatever. So what they would do is they would have a staff with a receptionist and maybe 2 nursing students, and then once or twice a week the doctors would come in and service their needs. But the nurses and the receptionists that were there, they would be able to ask them certain questions to already pre-know their medical condition before the doctor came in, like swelling of ankles and, you know what I mean, dry mouth and things like that that would show them that related to other diseases. We have Dr. Mutulu Shakur. Dr. Mutulu Shakur was a Panther, and not only a Panther, he was the founder of the RNA, the Revolutionary African. I'm so sorry. Yeah, he founded the Revolutionary Action Movement. Well, he was a member of the Revolutionary Action Movement. He founded RNA. He was a Panther. He was Tupac Shakur's stepfather. He was a member of Thug Life and helped him evolve the Thug Life ideology into reaching the youth in the streets. And so he was a doctor. And what he did was he used acupuncture therapy to help get people off of heroin. And basically, they would stay around afterwards. Like, you know, he heal them and they'd stay around and volunteer and join the party. You know, he was accused of liberating Assata Shakur or being a part of that, you know, because him and his comrade, you know, Sekou Odinga, we had Zaid Shakur, and we had, you know, the members of the BLA in the West Coast, and they were like the East Coast, and they was like so-called more like notorious of the Panthers or whatnot. So they were accused of a string of bank robberies and things like that. So Baba Matulu is still locked up to this day. He was supposed to get out in 2016, but they blocked his parole, I guess, because of his political activities. He's still very active. You know, he bees online sometimes giving speeches and everything. He suffered from bone cancer right now, and he really needs our help, you know, and our support. Can we go to the next slide? The FBI and COINTELPRO. Okay, yeah. So the COINTELPRO program and how it was inflicted on the Black Panther Party. We have to understand it was more than just the shootouts and everything. It was them being strung out on court cases, you know what I mean, taking up all their time. Sleep deprivation. With sleep deprivation, you know what I mean, cause you to hallucinate, you know what I mean, pick people that were enemies that not necessarily supposed to be enemies, you know, and even with seeing the attack on the Panthers, for those who were not directly involved in direct confrontation with the police, they would still be in fear. Like, you know what I mean? The people in the community seen what was the attack on the Panthers. So it gave them, what's the word for it? It basically scared them to be able to step up and try to do anything, you know? So they was afraid of that. Let's go to the next one, that next Black Messiah. And we know the first Black Messiah who they talk about was Marcus Messiah Garvey, you know what I mean, who said, people without knowledge of their past history is like a tree without roots. And that's really my point of going back into all of this, you know what I mean, that the Panther Party evolved into something because of the need of what the people needed at the time, you know. We might see ourselves different in different organizations and that and this, but the enemy sees us as one, and he used the same attacks on us, you know what I mean, that they use on our people from before. They sent in agents on Garvey. They used Black agents on Garvey. You know what I mean? They smear campaigns the same way that they did with the Panthers, the same way they did with Elijah Muhammad, Dr. Martin Luther King, the Honorable Malcolm X. And so, yeah, with the Black Panther Party and what they were working, it was they seemed like the next Messiah figure to come to America and stop what they were doing. I also want to note that African intercommunalism, likened to Garveyism, concentrated on all oppressed people across the world. That, you know, that we couldn't just stand alone being just, you know, here where we are. We have to unite across the world, you know what I mean? Because we've been all oppressed by the same oppressor. Like they said with the 99%, you know what I'm saying? It's just 1% of people that's exploiting and colonizing the masses. Can we get to the next, please? All right. Yeah, I wanted to bring up books to read in this. And the Black Panther Party Service to People programs. This book got 67, I believe it's 67 different programs from the Black Panther Party that they implemented, ways that we can implement them today, you know, restructure them. They ready for us right there. So you think about, what did the Black Panther Party do when it came to student movements? They have something in there, you know what I mean? So that we could follow and understand what they did and advance the struggle. It's about us standing on the shoulders of those who came before us, not trying to reinvent the wheel. The next book we have, Body and Soul. Body and Soul is about the medical apartheid and the Black Panther Party attempts to, not the medical apartheid, medical malpractice, and the Black Panther Party fight for free health care. So she points out a lot of beautiful stories in it. So one of the stories she talked about, Lane Brown, the story that she shared with us also, that how did they get the stuff that they needed? They would go to the hospital and act like they were sick, and you'd be in the waiting room for so long, or sitting in a room waiting on the doctor for so long, you know, you have all this time. So what they did was liberate, you know, a lot of the and I say liberate, I mean they got it for free. You know, they liberated stuff that they needed, you know, ace bandages, wraps, and things like that. And on one of these events where they was picking up supplies, her and a sister named Joan, they seen the wheelchair and looked at each other, and they instantly knew it together. And the sister hopped in the wheelchair, they rode on out and put the wheelchair in the back of their car. And the clinic had a wheelchair now, you know, and for other resources and stuff, a lot of people donated. Everything wasn't liberated. Even at the big concert, what is it called? Wheelhouse. I can't think of the big concert where the brother played the Star Spangled Banner, but Woodstock. After the Woodstock concert, they donated all of the medical tents and equipment to the Black Panther Party. You know, after that was over. And another one I want to point out was medical apartheid. The sister Harriet Washington, she talks about, you know, all the medical malpractices, the tests that experiments that they put on us, like the Tuskegee experiment, for example. The Tuskegee experiment, the Black lasted for 40 years, and the Black Panther Party had aired it out in their newspaper way before it even hit public media. You know what I mean? So it was like showing the importance of the party, that newspaper, you know what I mean? Being able to be in touch with the news and showing like, this book shows why we can't trust, you know what I mean, the government and their healthcare and all of that at this time, you know what I'm saying? Because we're going through COVID. And so like one thing she pointed out in her book, in 1950 in Florida, they let out droves of mosquitoes on the Black community and to give them whooping cough and stuff like that. Then they set up centers in their communities, you know what I mean, to monitor it and see how far along they go with whooping cough. And this was something they did to test to see if they would use it on China or Japan during that time. You know, she talked about the Tuskegee experiments, and what a lot of people didn't know, that they was doing the same thing to the people in Guatemala, injecting them with syphilis and letting them die of syphilis without giving them the cure, even after they found out that penicillin can be given to these people. You know, so I'm not surprised when they build up a testing center or something in Africa and the people tear it down and burn it up. You know, I'm not surprised when our people wait until their leg fall off before they go to the hospital, because you had this history of all of the stuff that they done to us. We're a woman to go to the hospital and, for a stomach ache, you know what I mean, and end up being castrated, or not castrated, but being sterilized. I'm gonna try to wrap it up and we get to the next one. Yeah, so on the mental health to die for the people. I wanted to note that Huey said these were survival programs, you know what I mean? Survival pending the revolution. You know, that these was not the complete answer, but we need to do something until we can see that revolution, and until we control the means of production, until we control the institutions. Also note that in 1969, that in 1 year, I think it was 28 Panthers were assassinated and more than 70 were in prison. You know, and so that was led to the revision of the program. You know what I mean? The gun, it captivated the minds of the people, but at the same time, it put a target on the Panther Party. So at this point in 1970, it was for them to, I mean, or 70 to 72 was for them to re-show their image, repackage their image to the people. These are programs that were already being done, but they were being showed in a higher level. And also they ran Elaine Brown for city council, Bobby Seals for mayor of Oakland, you know, Eldridge Cleaver for president. They say that the people need to control, you know, what's going on rather than these politicians. And I posted this picture right here. It reminded me so much of my Baba Melvin Dixon, you know, for the commemoration, who taught a lot of us in Oakland that's organizing today. And what he said was that if you don't have no programs, you ain't doing nothing. You know what I mean? For lack of better words, without no programs, you just talk. So it's about the people creating and building the programs that the people need today. Even back when in the Oscar Grant killing or whatnot, you could go to the next one. I hooked up with some sisters that we found out that the bullet hole went all the way through Oscar Grant, and they only patched him on one side and let him bleed out on the other side. And so these sisters started training from the people community medics, started training people on how to deal with bullet shot wounds, how to be first responders, you know, how to deal with seizures and heart attacks, because like you call an ambulance and they take forever before they get there. Or a brother gets shot and what the police do is rope off the scene and then, you know what I mean, and let you bleed out and die. So we have to be medically trained. We have to understand what to do. Even just taking Coca-Cola and pouring it on a bullet wound could clot up the blood long enough to help somebody survive. And it was important to know these things, you know what I'm saying, then and now. Yeah, this is 1972, People Conference. Can we go another one? I just got a couple more images. Sickle cell anemia testing, you know, because it was 98% of 98% of the people that got it were Black. There was no demand for them to start doing the testing. So the Panthers did the testing themselves. We can go to the next one. In some cities, you know, they didn't have as many resources to build the community health centers, so they used whatever they could. You can see here that they, you know, they did their clinic out of a trailer. And I think it's just two more. I'm wrapping it up. It's just a beautiful image. I just wanted everybody to see. Yeah, that's what I'm saying. Just scroll through the last two of them. These are just some images of some of the people at work where they traded in their leather coats for white coats. You know what I mean? The images of the party that people need to see today, because it's nobody gonna save us but us. You know, they're not looking to save us. They're not looking to fix our problems. They're using us as guinea pigs just the same way they did in the 1800s, the same way they did in 1619 when they came and got us from the shore. So it's on us to get back to our traditional ideals and what we used there. You know, we created the first heart surgeon. We created the first Black hospitals. We created, you know, people to get blood plasma, and we could do it all again. We could do it all again. The Black Panthers organized on what the people needed, and it's on us to see what the people need today, and we could organize it again. And the elders are there for us to look to for insight. So, yeah, that's about it, man. I'm wrapping it on up. I appreciate y'all. I know it was like I was supposed to talk more about the Black Panther program, but we had the elders here to talk about it who actually was there and lived through it. So I wanted to set the stage to talk about, you know, what was going on, the medical malpractices leading up to that, to make the Black Panther Party say that, you know, we need to create free medical health centers for our people.
Thank you really so much for this informative presentation. And I'm hoping that everyone listening, whether you're listening on Facebook Live or you're on the Zoom with us, you were able to learn a lot, just like I did. And so I'll pass it, thank you again, Jabari, and I'll pass it back to Eseibio so he can go ahead and he can lead us into the next topic.
Yes, so we have a brief, a small documentary about the Black Panther Party programs that Dr. Saturu Ned suggested that we watch. And then after that, we're going to turn it over to Professor Steve McCutchen and Dr. Saturu Ned so they can speak and take questions.
Can everyone hear?
No.
Okay.
Guns, berets, and leather jackets may be the images you associate most with the Black Panther Party. But what you may not know is how the political group shifted healthcare in the U.S. to be more community-based.
Our government is not going to provide healthcare. So we were going to provide healthcare for the people.
The Black Panthers opened 3 medical facilities, created the very first nationwide screening program for sickle cell anemia, a blood disorder, and they even helped establish a form of acupuncture that's still in use today.
We spend a lot more time serving the people. than we did protesting or defending ourselves from the police.
So why isn't the Black Panthers healthcare activism more widely known? Well, it may be by design.
History is written by the victors. The Black Panthers are not writing the history of the Black Panther Party.
Hey fam, I'm Imayan, and this Sunday on AJ Plus, we're exploring the Black Panther Party's history, healthcare legacy, and how a covert government program tried to bury it all. To understand what prompted the Black Panthers' foray into healthcare, you first have to understand why it came into existence. Here's how co-founder Huey P. Newton explained the group.
We are bound to transform society and erect a system where people will receive justice.
The Panthers formed on the heels of the Civil Rights Movement, a time when the push for racial equality and equity divided the U.S. 1965 was a pivotal year that helped spark the Panthers' creation, according to former Black Panther Billy Jennings.
You had the murder of Malcolm X in February. Also, you had the signing of the Voting Rights Act of 1965, and also you had the Watts riot happening in August of 1965, along with the Selma March in 1965.
Then, in the fall of 1966, a white police officer ran down and killed an unarmed teenager in a historically Black neighborhood in San Francisco. It was a breaking point. The community rioted. The governor declared a state of emergency, and the next day, National Guard soldiers marched with bayonets through the streets. This was the fertile ground in America's landscape that prompted Newton and Bobby Seale to found the Black Panthers Party for Self-Defense in October 1966. The Black Panthers' initial mission was to police the police. Panthers followed patrol vehicles ready to defend their communities with force if they felt the need arose. This is the part of their legacy that the world remembers. But the physical self-defense was a fraction of the Panthers' objectives. As their movement grew, so did their vision. Dr. Tolbert Small was a physician to the Black Panthers, though he wasn't a party member.
They were not just people in black jackets carrying guns. They were interested in actually doing something for the community.
The Black Panthers focused more on what they call survival programs, things like food assistance, free education, free legal aid. And one of their top priorities was free community health care.
Most of our civilized countries will provide these services for the people. The Panthers realized that we didn't have a civilized country. We were not providing these services for the people.
As a young doctor, Small treated political activists like Angela Davis and George Jackson in prison. And when Bobby Seale issued a directive for all chapters to establish free health clinics in 1970, the Black Panther Party turned to Dr. Small to help build the program.
I had all the pharmaceutical companies donating medicines to the George Jackson Free Clinic. I had doctors volunteering, nurses volunteering, med techs volunteering.
Sheba Haven, who was a member of the Black Panther Party, says the Black Panthers' approach to healthcare was radical.
I think that they had a great impact on medicine in general because they were progressive, not just in the idea that healthcare is a right, but in the way that healthcare is delivered.
The Black Panther Party interceded in places where the U.S. government was seemingly absent, like its nationwide screening program for sickle cell disease. It was a first.
The government was not prioritizing sickle cell anemia for the same reason that Jackie Robinson had to be the first black baseball player in 1948. For the same reason that the black troops were segregated during World War II. There was racism in this country. Sickle cell anemia was a disease that affected mostly black folks.
Sickle cell is the single most common genetic disease in the United States, and the vast majority of patients are African American. It's painful and deadly, and in 1970, the country only allocated less than $100,000 in funding.
It spent $7.8 million on muscular dystrophy, $1.6 million on cystic fibrosis, $8 million to get a man on the moon. And obviously, sickle cell anemia was not a priority.
Then an intriguing thing happened in 1972. John Lennon invited Black Panther members and collaborators to appear on one of the most popular talk shows of the day, The Mike Douglas Show. And they seized the platform to address the problem of sickle cell disease.
We've tested 30,000 people in sickle cell anemia. I think we've tested more than anybody in the country.
And just like that, sickle cell became part of the national conversation. The Panthers use their medical infrastructure to run tests for sickle cell in cities all over the country. So it is objectively true that one of the defining public health initiatives of the early 1970s wasn't launched by the US government, but by an organized group of socialist advocates. The initiative gained so much momentum that President Nixon signed legislation to aid research on finding a cure for the disease. By this point, the Black Panthers had become a major cultural force operating on the international stage. Their philosophy shared common ground with Maoists in China. And as China began to normalize relations with the US, they invited Huey P. Newton to visit months before receiving President Nixon. And that visit was a major reason why acupuncture entered the American mainstream.
Acupuncture existed in the Chinese community already, but the Chinese community in America was more insular and more like an enclave. Right? We introduced it to the rest of the world.
The year after Newton visited China, he sent a delegation of 19 people to the country, including Dr. Small.
When they came back from 1972, we started talking about acupuncture more. And we had people practicing acupuncture on both coasts.
The Black Panthers also helped run the first health clinic to implement 5-point ear acupuncture. That protocol is still used today to treat conditions like drug addiction and post-traumatic stress. So the group had a major influence on healthcare initiatives in the US. Why then does it seem like that narrative has been hidden? Why are the Panthers so often associated with this rather than this? It's partly because of controversial FBI Director J. Edgar Hoover and a little program you may have heard of before, COINTELPRO.
Well, one of the things that J. Hoover always talked about was Black people being unified, a messiah coming to unify Black people, which he was terrified of because he was a racist.
COINTELPRO, or Counterintelligence Program, was a propaganda and surveillance operation that the FBI used to target activists, political groups, and minorities.
COINTELPRO was basically designed to destroy members of the movement that they felt was a threat to the American government and the American way of life.
COINTELPRO's goal was to discredit leaders and divide movements, or as the FBI put it at the time, to pinpoint potential troublemakers and neutralize them.
The power structure did not want to show the survival programs of the Panthers. They wanted to paint them as people who were committing crimes and violence.
Of the 290 operations carried out by COINTELPRO, the Panthers were targets of 245. For those of you that enjoy math, that's more than 84%. Hoover personally instructed 14 different FBI field offices to submit imaginative and hard-hitting counterintelligence measures aimed at crippling the Panthers. They sent death threats, offensive cartoons, and forged letters to different members in an attempt to disrupt and divide the group. Perhaps the most insidious part about COINTELPRO was how effective it was in controlling the narrative around the party.
What the FBI and the government wanted to push, that the Black Panther Party was a black and angry group and they were anti-white.
So if you want to paint someone as a devil, you're not going to paint them as providing health care, providing free food, taking care of elderly people to the hospital, providing a free ambulance service like we did in North Carolina.
And in a way, it worked. Years of police raids, misinformation, incarceration, and killings not only reduced membership, it left the organization financially crippled and ultimately unable to carry out its social programs. The Black Panther Party was officially disbanded in 1982. Today, many of the same structural inequities that the Black Panthers fought against continue, including access to health care. That's resulted in some devastating statistics for African Americans. In 2017, the American Heart Association said that African Americans have the worst cardiovascular health and more deaths from heart disease than any other group. They also have higher rates of HIV, diabetes, and chronic kidney disease. A 2007 study shows that African Americans are much less likely to trust physicians and the overall healthcare system.
You'll see that the statistics for Black folks is vastly inferior to the statistics for white folks. And the Panthers recognize that there's racism in healthcare, and which is why they got involved in trying to provide healthcare for the community.
But the Black Panther Party's legacy lives on. Many Panthers and volunteers with the party have gone on to work long careers in public health and medicine. Even the New York Health Commissioner, Mary Bassett, spent her early career volunteering in the Black Panthers Free Clinic.
The legacy of the Black Panther Party will never be forgotten because those things are embedded within people's families.
Shortly before he was killed by police in 1969, Black Panther Fred Hampton said this.
That you can jail revolutionaries, but you can't jail a revolution.
And that revolution always included a demand for healthcare as a basic human right. Hey fam, thanks so much for watching. Don't forget to like, share, subscribe, and follow, and let us know in the comments if you knew anything about the Black Panthers healthcare legacy, if you feel like there are any solutions they brought back then which could work today, and tell us also what you want to see us do next. We'll see you next Sunday. Guns.
So
Go ahead,
that's
Eseibio.
our presentation portion of this conversation. So I'm going to hand it back over to Eseibio so he can lead us in introducing the guest speakers that we have for today.
Okay, all power to the people, APTTP, AP to the P. Now we're going to bring up original Black Panther Party alumni, Professor Steve McCutchen and Dr. Saturu Ned, and they're going to take over from here. They're going to speak a little bit about the Black Panther Party free healthcare programs. And if you guys have questions, then you can type them in, and then they'll answer your questions. Okay, Dr. Saturu and Professor Steve, can you hear us?
Yeah. Can you hear Steve?
Good to go.
Yeah, go ahead. Yes, Professor. Yes, Professor, go ahead and lead off the conversation.
Oh, all right. Let's look at this. Good comment, good intro from my brother Jabari. That was a great production by our man, Dr. Tobin Small. We have to have, always have to have hats off to Dr. Tobin Small.
That's
without
right.
his input, without his his support of the party, his vision, and his ability to express that vision to others in the medical profession and down into the community. With that, when we look at the incidents, when we look at the history of healthcare as it pertains to the Black Panther Party, the coming into existence of the Black Panther Party, the very coming into existence, even though never spoken in the early 10-point program and platform, never generally addressed in our social programs and our daily activities, the very coming into existence points to the party looking at and addressing the well-being of the Black community. That was critical, but it was imperceptible. That point was imperceptible. It did not become perceptible until we made it so, not only through the incidents of police brutality, murder, and torture, but we brought it, we signified it and articulated when we identified and developed the free health clinics. But by the existence of the party, it was always the physical well-being of the community. It was the mental well-being of the community, exemplified through our community survival programs and articulated through the political voice of the Black Panther Party. Those things, again, always laid below the surface because of the early images of the Black Panther Party. But then again, as people saw that the party did have within its framework, within its vision, original vision all along, we did have that well-being, which eventually was identified, articulated through our free health programs and those outreach and fieldwork programs. When they were finally identified, this gave another view of the Black Panther Party. But the healthcare, the physical well-being, and the mental well-being of the party was always there as part of the underlying means of resistance, of building resistance, of identifying resistance within the historical nature of the Black communities. So even though people did not put those two together, put those ideas together in terms of physical and mental well-being and the political agendas of the Black Panther Party, they were there. We just did not have time always to articulate those particular agendas. We did not have all the time to address those particular needs and questions. And going to the need for preventative health care, when we look at the American Medical Association, when we look at most of Western medicine, we look at treatment first. We see that treatment is identified first. That is addressed first. We look at prevention first. If we address the causes of some of the illnesses, physical and mental, it's a lot simpler in the long run to provide for a healthy community and a healthy population of people. But in a capitalist system, treatment goes to profit, and profit is what drives the AMA, the medical profession, Western medical professions. So there was no immediate attention given to prevention of imbalances, disorders, and those physical diseases which developed, particularly in the Black and poor and oppressed communities. Treatment, and as we have seen, goes to medical costs. It comes through the organized structure of Western medical associations, and this automatically cuts a majority of Black people and poor people out because they are not able to afford the high prices for medical care. Going back to Dr. Charles Drew, because of his race, he was not able to be treated for his accident, which led to his death. The person who brought blood transfer and blood plasma into existence made it relevant in the medical field. Looking at that particular example for one, but look at all the other undiscovered, unmentioned notices of poor health care or neglect in terms of health care because people could not afford to pay, could not go into the emergency ward. They were turned away either because of segregation and the racial barriers, or they were turned away because if they had a long-term chronic condition, they could not afford treatment. So the Black Panther Party, through understanding the needs, the medical and health needs in the communities, that we can at least find a short-term intervention that will help salvage some of the medical conditions, the health needs in the community, until we can catch the attention of others, and hopefully they will find that profit first does not save lives. So Saturu,
Yes, absolutely. Thank you, Professor. Speaking of sickle cells, since recently, since DNA, there's actually over 10 world populations. There was the immigrant population from Dominican Republic, Latinas, from India, from Turkey. They too are affected with sickle cell anemia, and that was our pandemic. And echoing the things that Professor McCutchen just mentioned, we understood the underlying conditions, like a sister program to that, recognizing that children had children who were not going to school, who needed the care and products that they weren't able to get. As he said, it was a bleak world we lived in. It was like the Sahara Desert. No medical, no food, no anything. So the WIC program came about. Helping us.
I think we lost him. I think his video is
Which
frozen
was
up there.
Okay. So until we get
the
Saturu,
breakfast
you come back?
program,
Okay.
bringing the school-age children, had children who were not diapers, who needed the care and world treating one of those underlying conditions of malnutrition, what affected the underlying conditions and prevent. And the other aspect, sorry, it's kind of freezing up somewhat. Can everybody hear me? Can you hear me? It's frozen up. Can you hear me?
Yeah, you kind of froze.
We can hear
Frozen up.
you now.
Yeah,
can you hear me now?
Pieces of you. Just pieces. Now, are you there?
Can you hear me?
Pops. No, Pops, you might need to dial back in.
I don't know.
You might need to. He probably dial back in. He'll be good.
I guess we could take like one question until Saturu logs back in. Unless Professor Steve McCutchen has something else that you want to say.
Sure. We need to remember, particularly as we look back at what the Black Panther Party did in terms of preventative health care, we have to look also at what some of the poor, more developing nations are trying to do. They are trying to develop a means of prevention in terms of the spread of COVID-19, as they have been doing with other infectious diseases and imbalances that had been carrying in their country. If the developing countries in more developed Western territories around the world, if they would look at the nature of the health, the basic health care of its people, rather than in turn of the financial integrity of its health structure, then people will be more enabled, more empowered to the services that they have a right to. But because again, globally, there are no, except for in Cuba, perhaps the People's Republic of China and the Republic of Korea. Other than those, they're and perhaps to a degree in Canada and in England, there are no healthcare systems which can provide healthcare at levels which will try to accommodate not those who can necessarily afford it, but those who deserve medical care and medical health without the high cost of healthcare insurance. As long as the world is a dispute over the cost of medical care, more and more people are going to die, not because of any illusion about population growth, not because of attrition within the populations due to internal frictions. More and more people are dying because they are denied that basic right to health care. And unless the governments and the agencies who are responsible for medical care do not learn from the lessons of the past and do not learn from their own medical science, more and more people are going to continue to suffer at both the physical levels and the mental levels. Fortunately, there are a number of you and us who understand their conditions, but there are not enough efforts. There are not enough materials. There is not enough support to provide the services and the quality of life insurances that people, that the masses of people need to survive. The rich and the entitled are not privileged to health care only. All of humanity, all people are entitled to basic health care, and that health care which will ensure not only their individual survival, but the ongoing survival of eventually what's left of humanity. Saturu, are you back or? I know you're trying to get in there, Saturu.
Unmute. There we go. Down there. Can you hear me now?
Yeah, we got you.
Yeah.
You're
Well,
coming
anyway,
back. You're coming back. You're coming back.
Yeah, I'm coming back. Yeah. Can you hear me? Yeah, I'm coming back. Yeah. The idea here, as I was going to mention before, I hope. Going to mention before, I hope as Black people or people of color, we men don't know what affects Black men.
You're still breaking up, Saturu.
This is one of the things that we brought to the table. In order to prevent illnesses, the concept we had to figure out what was wrong with us. And even today, women aren't told that thing simply because. Well, I'm just not going to worry about it. Nothing I can do. My video was not the host to stop my video. Keep talking. They cannot determine anything simply because nothing I can do. My video was not on either. So I don't. The host stopped my video.
Sometimes if you're having trouble, if we have trouble hearing you, it helps to stop your video.
Can you hear me now?
We could hear you.
Yeah.
I don't know what. Sorry, I apologize. I have no idea where I'm at. This connection seems to go in and out. Very quickly before I get cut off again, I was mentioning the fact that we really don't even know what is wrong with us in terms of what affects Black women at certain ages. What are the health things that we need to know for ourselves, our children as Black males? You always hear about it at the last point, and because we don't trust medical personnel and the system, Black males will go and they'll be stage 4 or stage, they'll always be, because of the fact of the medical information and knowledge has not been given to us of what we need to look for, because there is no cure or there is no concept involving sickle cell anemia. About a month ago, 2 months, 3 months ago, a doctor was on there, 60 Minutes, talking about he thought he found a possible cure through transfusions. But the U.S. government will not give him money to create a cure for sickle cell anemia. The first case was documented here in Oakland, California, 1971, when the Sickle Cell Anemia Foundation, under the leadership of Dr. Spall and the Black Panther Party. As was said, we actually, over a period of time, tested over 500,000 people. That was our pandemic. So the question begs also, with the misinformation that we have about COVID-19, I personally have a brother and my sister who are now fighting COVID-19. How is it affecting our community? We need to know this, and how our young people can also come together and learn what we need to know about this, because there are like 90-something symptoms that people could have. They're baffled by this. But as far as our community, that is part of the resurgence of knowledge of healthcare, in particular concerning this particular thing. Young people really need to know what this is doing to us, to protect our community, to protect our elders, and to protect our children. So there's a lot that needs to be dealt with and talked about on that level also. So the example that we took into our hands, going door to door, we created our own testing facilities. And so the objectivity, it can be done again today in the same way. Now, one other thing that we do also, I want everybody to know, is that we're going to be talking about at some point with our good host concerning an ongoing educational series, which we've launched. We've been featured in newspapers all over the country. The concept of Eseibio as legacy keepers. You are all legacy keepers. And we have a network of people in every profession who is basically part of the concept. So the healthcare issue is something that, in order to understand how we did what we did, what was the understanding ideology, and right now some of the things that we're teaching everyone are what we call, we actually have 66 questions, which are, some are fallacies and misnomers about the Black Panther Party. The advantage, and I've stressed this over and over to everyone, we are still here. Myself and Professor McCutchen and others, we and Melvin Dixon, our comrade who passed, we all had an average of 14 out of the 16 years of being in the party. We saw all the transitions. We understood what we got involved in, from healthcare to voting to creating stability for businesses in our community, all these concepts. And healthcare, the important issue, was really one of the things that we tackled pretty much from the beginning. And I just wanted to clarify, after Sacramento, that was an event, a statement. We were no longer patrolling the police. After that incident in Sacramento, with Mulford and passing the act where you can no longer carry a weapon to patrol, we no longer did that. And soon after that, we came out of the black leather jackets and berets. So the idea here is that we went forward and created these unbelievable programs to stabilize our community, to have our people for the first time understand what cooperation was. Not only were established in our community, but there were also established breakfast programs, and our Latino brothers and sisters in the Fruit Bear were creating one. The Young Lords, the Brown Berets, the Native Americans on the reservations, even the Rainbow Coalition. You might not know their story. The poor whites called the Young Patriots. They were Confederate flag waving people who became some of our allies and our brothers and sisters. So galvanizing everybody around the continuing issues that plague oppressed people, Black people, and we understood that it was, and still today is, a class struggle. So here we are again now. We have the most unbelievable opportunity. We want to pass on everything that we know and that we did to you guys, to this generation. We have to begin the process. We might not see it to the end, but for our children and our grandchildren's sake and beyond, we want to create what we call, we do want generational wealth. We do want a socially conscious community that says never again will we depend upon a system that has proven that they want to see our total destruction. Brothers and sisters, ladies and gentlemen, we're at war. We're at war for our very survival. And people always used to tell us, and Professor McCutchen, I wish I had been there with the Black Panther Party. You are here now with former members, alumni members who are willing to do the work. And there are many others out there who are coming to the table. So I just wanted to say that this was very important today to talk about healthcare. And most importantly, we probably need to create some type of forum to really talk about the role of what is happening in the COVID arena and how we can address that using the examples of organization and knowledge and education that we use during the Black Panther Party as we created our own health clinics. I want to get that out real quick before I get cut off. Professor Steve, can you still hear me?
Oh, right, I'm still here.
Yeah, good, good.
Okay.
So, go ahead.
When we look at the physical health condition now, in terms of the COVID situation, one of the tangential effects of COVID-19 pandemic, we have to look at how it has affected people's mental attitudes, how it has affected them in terms of their personal development, how it affects them as we interact with other people. We find that mentally emotionally it hasn't affected us. We find people becoming depressed, people becoming more distant in terms of how we want to casually walk past people, how we have to be mindful or conscious of being protected wherever we are, how mindful we have to be protectful in terms of sanitary and health conditions. We become more acclimated. We are being conditioned to being acclimated due to this particular infectious disease, to this natural disorder. And that has a mental effect on people. It goes to their well-being, to their state of mind. When people get up during the day, they have to figure out, they're trying to think about, what do I have to do to get out the door to stay safe? What do I have to do once I'm out the door to stay safe? How long do I have to stay isolated? And what am I going to do once I do come into contact with people? That has become a burden mentally to people. So that is the only thing that people can be concerned about right now, since there is no treatment. There's no way of balancing this out so that people's physical state of being can return to normal. So of course, that's going to continue to be there. So people's mental state of being is not going to return to normal. All of this has been accented, been elevated during the existence and the presence and the social conditioning that has developed through the presence of this and through the tragedies that have occurred because of the existence and the destruction of this particular coronavirus here. So this addressing the mental conditioning of people is one of the things that through our programs, through the Black Panther Party programs and through other programs, we see that these go to touch on the mental condition, because people are in a position where if they get fed, they feel good. People get a little bit to help them go look for a job, they feel good. When people find out they got some new, better clothes on their back, they feel good. All right. So these things that affect people's mental health were incorporated into the other programs of the party, but the People's Free Medical Health Clinic, even though it didn't address it directly, the mental health went hand in hand with looking after the physical well-being of Black and poor people. And again, going to the point of the existing pandemic now, we have to consider not only the physical losses due to the coronavirus pandemic, we have to look at the mental and emotional toll that it has taken, particularly among young people, among Black people. If it's going to hit whites and those who are in a better position economically and socially, if they are being affected, you know that the Black community is suffering at cesspool levels. So we definitely have to look at that, look at the mental well-being, the mental health of Blacks during this period of this pandemic here, during this period, when looking out not only for the physical well-being, but for the mental well-being here. Those are things we cannot push to the side, regardless of whether people want to talk about how stable someone is or how unstable someone. We're all unstable somewhat right now due to the presence and continuing existence of this particular pandemic.
And that is very key, the statement that he just made, simply because also the historical significance, or I like to say our story and significance of how it was dealt with, how the program, I feel good, I got a full stomach. I just got a checkup at the health clinic. I just got food from the WIC program. I just got a new pair of shoes from the clothing program and the shoe pack. All these things help with the mental well-being, but those concepts have been lost, and the teaching aspect of knowledge of what we're faced with, what is happening to us. This generation has been, well, several generations have been devoid of that knowledge, which has purposefully been kept from you guys. I guess they thought we just go away and disappear, but we're here for a reason at this point in time. So by bringing that knowledge, we're going to be here for 100 years, you guys. But anyway, for all that knowledge and experience that we knew, because I want you to realize this. When somebody tells us, oh, how can we be done? Well, that's the mental the low level of the mental thought process has gone under the barrel. We can't do anything. And we always remind them that when we did what we did, we had no blueprint. We were equipped with some ideas, a thought pattern, an ideology, and a scientific method of application, which we learned, despite all that we were faced with from this government and the oppressive conditions they tried to do to destroy all the work. Still, for 16 years, 63 survival programs were initiated. So this is why we are teaching our classes to get people to understand the historical significance of what we're faced with.
Okay. Dr. Ned, Eseibio is chimed in. We need to get to the Q&A, but I want to say one thing, just off your point. If we had asked all those questions before, and we had answered all those questions before, and we had found solutions to all those things before, guess what? We would not be having this conversation today. Not be having this conversation.
Go ahead.
So Eseibio said we need to get to the Q&A.
So before we start, you know, I have a lot of questions, but I'm not going to ask a lot of them. I just want to thank you guys because this is very important for the young generation, the information, the knowledge, and the education piece of the Black Panther Party and the different programs. Because as young people are educated in our systemically racist educational system, some of the important information is never presented to our young people. Me being 41 years old, just knowing about the 10 steps, I didn't get that in school. I read books and got some of the information, but we didn't get that, right? We have in our community with gentrification happening, we have elementary and middle schools named after Dr. Charles Drew, and our young people don't even understand the significance of his work and what he found and what he was about. And I think education is the key to all of it. But the frustrating part is, as we hear both sides of the conversation, we always trying to come up with solutions and things of that nature. We are still today dealing with the same issues from when the Panthers started, the medical issues, the disparities. How do we move forward politically, financially, community-wise to really impact and change the classism and the capitalism that has affected the Black and brown community historically? That's the first question I wanted to ask.
Go, Saturu.
Okay, well, one thing I had already mentioned before, you know, concerning that, and then number one is understanding your conditions. And I want to mention to you, we have parents coming up to us all the time. My child is not learning anything about themselves, their history, their knowledge, or who they are. They're not teaching that in the school. So one aspect of that started, we have been attempting to, and perhaps we get a little help with this. We want to engage, even if it's Zoom classes right now, because normally we'd be going to class and start teaching our children initially the historical significance of who they are. And we started not just with slavery, we always talked about after emancipation and tell them the story of Tulsa, Oklahoma. Our economic Black enterprises, I don't use the word Wall Street. When they hear about these things, the light goes on, their whole attitude changes, and their whole understanding of why I should learn math, why I need to learn anything is because this is who I am to take this change to the next level. I never knew these things. So engaging them in that, like them not even knowing the fact that we created everything in America. When you tell them all the things we invented, besides what was stolen, it is an amazing concept for them. Now, as young adults and people in that arena, that's why we want everyone, as we continue to put these, what I call our educational classes, bringing that knowledge forward. How, why, when, and most important of all, we want you guys to see it through our eyes. And I think we're pretty good at doing that when we give the classes. We were 19 years old. We had members as young as 15. So when we say youth make the change, make revolutionary social change, it was true in that respect. So it opens the door for the youth of today to want to gain that knowledge and understanding to go forward of the how to. That's why we have the session set up where we explain to them and get rid of all the misnomers, because you're learning directly from those that created the legacy. Number two, the ability to teach them knowledge about how we made it happen. What did you guys think? What ideology were you using? What are some of the things we need to know to start implementing the things? And I'm going to tell you this. We have already surmised that at this point in history, if you have that plan intact and we put their feet to the fire, they're willing, they will come to the table now. Because right now, when people even talk about defunding the police, there is no plan. We could come up with a community policing plan. We know what to do. But there is no plan. If I have this money, I'm not going to give it to you to help change the conditions in your community, and actually diverting funds from the city that's earmarked for the community to make these happen. But in order to do that, it's the understanding of the how to and the knowledge of accomplishment that is a global track record. So that's part of my answer. You might want to add some things on to that, Steve, or chime in.
Okay, and you had another part of your question that went to classism and racism in terms of approaching these conditions. Remember, both of those conditions, those are long-term, longitudinal conditions now that have existed through the first contact between Blacks and Europeans in this country here. So this is a long-term social condition for one. And because of the ideology, the dominant American ideology, is that process has always been interrupted by misinformation, disinformation, and the undermining of those who seek to address those issues. So as long as those interruptions are there, if there are not enough people who have that concrete information to pass on to others, and others who are able and willing to take action, then we're going to have the bigotry, the bias, the discrimination, the racism. We're going to have that because it has become institutionalized. Too long this has been accepted as part of the American drama. But just as Hollywood can change the script, so can this script change, but it does not change weekly or monthly based on a program. This has to change because people understand that racism itself is artificially created by the social greed, the social anomalies that people bring to there because of their belief in terms of entitlement and infringement. Only through learning, continued learning, and then the actions to minimize the idea of racism, of one person, one group being better than another, one is more deserving than another, until we find a common ground for that type of understanding. We're going to have those segments, those populations of racism. And as long as those segments of racism exist and persist in our institutions, in our daily lives, we're going to see that as it flows down through our employment systems, through our medical system, through our educational systems, and through our political systems, and how we interact with each other at not only the national level, at the local level, and how we interact with other people around the world. Until those conditions are addressed, understood, and internalized, we're going to have racism. We're going to have that condition there. And so it's not a Band-Aid solution. The party never came out with Band-Aid solutions. We didn't come out with an answer. We came out with a problem, with a question to address a problem. And unless society and individuals learn to address the problem instead of reaching for a Band-Aid, then those conditions are going to exist.
Right. And a perfect example, the word that's thrown around, it always seems that, what we have is what we call mainstream America splaining, using terms like systemic racism, which is a joke to us, because we say, well, let's talk about disenfranchisement. Let's look at everything
that our community is lacking. And let's look at the fact that when we try to obtain it back, you created redlining in every kind of way, from not giving loans, indecent housing, indecent education, everything that we addressed before. So as Professor McCutchen is understanding the whole dynamics of how they put it there. We use the term power structure in every area of our life, from medical care to imagine someone there with those very racist attitudes saying, I did my part. I denied Steve McCutchen a job. I did my part. I denied Saturu Ned
Been there,
an
done that.
apartment, a house. So I can't remember my name. So in essence, this is what we see, that whole network of every area of our life, from when we were first born to going to school, all the way to getting a job and everything else in between. So those are part of the things, and understanding those, then you come forth and create what we call problem solving concepts.
On that, Saturo, concept that Huey had left for us. It was introduced in a booklet that he and Sister Erica Huggins wrote years ago, Insights in Poetry. In that, there was a short selection from Huey. And Huey said, in one of those sections, he said, I met someone the other day, and they were a part of me I did not appreciate. When we look at racism, when we look at the products and byproducts of racism, we have to look back to the causes. We have to look back to how it has been created, and we look back at the fact that racism is perpetuated and continues and will continue because the institutional basis of American hypocrisy is based on the fact that it has not looked at a part of itself that it does not appreciate. It has not found that in itself, so it cannot see that in the rest of us.
It's like the movie Blind Spotting. I only see and do what I want to see. The rest is not important.
Right, Rico, you got a question, Rico, and then Jada, you want to see what we got going on in the chats, and anybody that's attending, if you want to come up and ask a question, please raise your hand.
How
please
do you
use
raise
the chat
your
and
hand?
question as it.
How do you
go? Go ahead,
how
you
do
can
you
just
do
speak,
that?
but everybody else just click the more, and it should say raise your hand or lower your hand in the corner. But go ahead, brother.
Yeah, my name is Amin Cooley from the Legacy Keepers. My question basically is
right on, man.
as far as what's up, pops? My question is COVID. COVID seems to be killing blacks and browns and more people of color at a pretty fast rate. Do you think do people think that that was made to kill us off? Was that made to actually kill us off?
Saturo, you want to take that first before I step into it?
Okay, because I know, yeah. Basically, here's the big mystery. We were talking about all of a sudden you got 97 symptoms, everything to your jaw hurting, to your toe hurting. You have a mysterious disease. Here is the concept that is baffling to us, not understanding it, but at the same time, letting it have its way amongst people of color. Not really designing any concept. But Black people are 5 times more affected between Black and Latino, 5 times to 10 times more to die in the hospital, yet and still there is no concept to educate. So even if they looked at it and said, oh, this is purposefully created to kill certain segments of the community, they are still allowing, through their racism as a tool, to say, let it ride. If it takes out that undesirable element and population, then we can do so. And we're going to still use the same tactics of misinformation and no information about how they're being effective until it's too late. So we can really look at that side of the concept because they really don't have a clue. But for us, this is why that educational concept about who it is affecting, and what I mean by who, I'm talking about in our communities, and what we need to do
to create what we call the knowledge of what is happening. And then we come up with a practice. Here's a theory, we know what's happening. We come up with a way to inform our community and cut those rates down and basically start looking at it and servicing ourselves. We did it before.
And again, going back to old saying, look, if there's a cough, if there's a cough in the white community, the black community got pneumonia. So
yes, right.
we know. So we know whatever happens in the dominant society, we are still going to get the worst effects of it because it filters down because of socially how we interact, socially in terms of our demographics, economically because of how we have to be able to afford living conditions, housing conditions, how we can afford our medical care, how we can afford the educational process, the ongoing medical process. So we know that whenever it's going to be a slight sniffle someplace else, we know good and well we're going to be on an incubator sometime down the road, someplace down the road. So those things there all should help our people prepare from what we've seen through long years of these types of deprivations, these types of experiences where we are last served and least served and worst served. So anything that comes down the line, we need to prepare for. We need to learn new things as they come along. And those things that come along, we have to look not only at the individual level, me first, I got mine, hey, I'm okay, everybody else do for yourself. We have to go back to that old school mindset, that old commune mindset in this technological age here where we can still bring people together regardless of where we stand socially or economically. And knowledge-wise, we have to do that. We can do that, but only if we are willing. Those more knowledgeable pass that on and bring those services and activities. Those lesser have to be reached at their level. They have to be reached at their level so they understand, so they are willing to acknowledge that there is some progress, there is a means that we can maintain a healthy living style until there's a better way down the road. We have to find that lifeboat, that life raft to get us to that oasis, especially in lieu of this pandemic.
Yeah, Eseibio has his hand up. That was a great message. And I think some of the stigma in the Black community too is, just some of the old thinking that we have in our communities, even in this pandemic time, people are not taking it serious. And it goes back to just, this Black thinking of like, we're Black, it can't affect us, and not taking it serious. But I think also where we have the most shortage as Black people in the medical fields, in the community, I think will actually bring people back more close to be involved with it, to knock some of those stigmas off. Because I think people are more comfortable when they see people that look like them. And I think because we have such a shortage of Black males and females in the medical field, it is definitely hindering the community from getting the actual medical help that they need.
And to complement that point there, we have to understand that just because we don't believe in a thing, we believe in something we learned from a generation or 2 or 3 generations before. We have to learn to accept that as knowledge progresses in any of the fields, none of it's perfect, none of it's absolute. If there's a progress made in terms of knowledge and understanding, which transforms into updates in terms of our medical care, we have to investigate it. We can investigate it. We don't have to take it blindly. We don't have to accept anything blindly. We don't have to accept anything blindly from 100 years ago, nor do we have to accept anything blindly from what was given to us right at the moment. We can investigate, we can learn before we expose ourselves to fallacies and continue disinformation, misinformation, and being discouraged to create fantasies in place of knowledge, understanding, and successful application of that knowledge and understanding.
Yeah, and I just want to give one example. You know, you guys might have known that, of course, you know, we did have an international section in Algiers. We had relationships with 8 other governments in the world and 30 different chapters and branches, even outside of Tel Aviv. Where I'm going with this, Cuba has a program which the United States stopped, where they are actually bringing black people who are in medical school, paying their way, giving them a stipend. Everything was taken care of, and the Cuban doctors are some of the best in the world. It was hooked up to where when they came back, they would automatically be hooked in to hospitals and medical facilities. That's how good their
All right,
medical
take him outside.
facility is. How good their medical concept is at this point in time. So this is one example of how they blocked us from even having trained professionals outside of this country by cutting off that network, as they have done here in America.
My question, this is a question that we collected from the community. How did you guys fund the medical programs? Like, did the hospitals donate supplies, or the hospitals involved? How did you guys go about funding?
I can tell you, I know for a fact, like we had a great partnership here in Oakland with the George Jackson Free Health Clinic off of Adeline Street, because we were working hand in hand with actually helping them create viable cures for the children at the Oakland Community School. Many of you might not know about the award-winning Oakland Community School and Learning Center, won award for educational excellence. But our relationship with them, and also helped us with the WIC program, our relationship with them in that respect created a situation where we were able to work with them on a consistent basis as far as them contributing and helping us establish it. Dr. Bert Small himself went forward, and we all started talking to doctors and nurses. As a matter of fact, a lot of the doctors and nurses who work and volunteer, you saw the one commissioner of New York, they all ended up, a lot of them ended up with Doctors Without Borders, offering their services to oppressed people around the world. So Dr. Small would go and ask the medical people for samples, and they would give samples. We had Vietnam vets would come in and teach us how to use the electrophoresis machine, who were medics, in terms of doing the sickle cell anemia testing concept. So in essence, medical personnel would come and volunteer by asking doctors and nurses. We also would get samples of medical supplies that were needed, as he was a doctor, from pharmaceutical companies and their reps. It was an unbelievable. This is part of the untold story of even people who were in positions in certain companies came to the table to help us because they saw the value in what we're doing. So that was one of the ways that we were able to do that. And then you had doctors and nurses who also would bring supplies and also bring certain machinery that was needed, given from the hospitals. You know, they always get new stuff. So instead of throwing it away or sending it off to a foreign country, a lot of times if we needed things in our clinics, we would get it on that basis. So a lot of that, that's how it was done. And that was the consciousness of the day.
Rico, Jada, y'all got any questions?
I have a quick question. So, in the climate that we're in, me and John, we're involved in a lot of things that's going on, and we notice that the revolutionary spirit of your day compared to the revolutionary spirit of this day is totally opposite of each other. Where I think, and from what I've noticed, the genuine care for the community in you guys' time was there, right? The Black community really wanted to see the Black community make it. I don't know if you guys had opposition with your own people. I don't know how you guys weathered through it, if it was there. So I guess the first question is, was there opposition with your own people, and how did you get through that? But then the other question is, how do we get our people out of the mindset or the scared mindset that has been put or planted in their mind around the Black Panthers. Because when people talk about the Black Panthers, even though we have a lot of people who are educated and who probably read the Black Panther books, we know that these programs actually work. But when we go and we try to create systems that work, no one ever goes to the blueprint that works. So that concerns me. And I just wanted to know, what are you guys' thoughts on how do we get individuals unafraid to do or to bring up those models that already actually work? Because I don't know what's the fear, but it seems like there's a fear there as it relates to the Black Panthers. And then also, if there were any Black people that were opposition of the Black Panthers that was a part of the community, and how did you deal with those individuals?
Professor?
Okay. You asked about 3 or 4 questions there.
Yeah.
5 or 6. In terms of looking at what happened during the era of the Black Panther Party and what's happening now in the contemporary days, we have to look at 2 things. 2 things that are fact. That everything that happens socially is a part of an ebb and flow process. Nothing is ever continuous. 2 things. The second point, that whatever happened last year and is repeated this year is not repeated exactly. It becomes a spiraling process. That's how the development occurs. There's going to be slow moments. There's going to be moments that are imperceptible. They're going to be peaks and valleys. But that process flows and ebbs and it develops. Sometimes people do not even notice there are changes. They do not even notice people are being involved, only because of the attention not given, the attention not drawn. So because I'm not aware of things that are happening doesn't mean that something is happening elsewhere. So this is one thing people need to be cognizant of in terms of fears of Black people. People only have fears of anything if they come into contact with it and they have a negative experience with it. They have a negative experience with it, or they are just apathetic toward it. So guess what? You provide the means where they are no longer apathetic, begin to move. That means education.
Right.
They have to come into contact with either the history, the examples, or the actual condition itself to change their knowledge and their understanding. And this is again a part of a long-term process. This is not a Jeopardy question. This is not a Wheel of Fortune situation. We are talking about the movement of people's knowledge and understanding through a long period of time and through different degrees of understanding. Only by doing that, if one person can't do it, then pass it on to the next. They may be able to say it and do it better. If they can't do it, pass it on to someone else. They may be able to say it or do it better. One person can't say the same thing to 5 or 10 different people because they are going to hear it differently, they're going to observe it differently, and they are going to be interpret it and respond differently. So that process becomes continuous. The change has to occur by different people applying different approaches until they find something that is going to reach those who are either fearful, apathetic, or ignorant.
Yeah, I think that's a good point, the way you present that, Professor, because, you know, like Rico said, I think earlier you kind of reached on it about the mental health. So we involved with a lot of the city meetings and some of the advocacy that's going on for mental health and funding and getting Black people into mental health. But I think you hit on something earlier that I think me and Rico both been trying to get people to understand about mental health, right? The stigma of it, one, keeps Black people away from getting it. But when you talked about people getting clothes, people getting jobs, people getting help, people getting praise also helps the mental health and the spirit of people. So how, my question is, how do we get our mental health professionals, our psychologists, our clinicians, the people who advocate for mental health, how do we come up with ways like you presented with clothes and money, and we try to tell them that's part of the mental health process? How do we get them to encourage and incorporate that into the advocacy of mental health to actually get people involved and engaged? Because I always say that, they talk about people have, it's just a standard thing, right? It's just Black people have mental health or brown people have mental health, but we don't really dissect why the mental health is so impacted, right? And a lot of it is financially. When people have financial resources, they're more happy. It's proven statistics behind it, right? When people have clean clothes and bathing and being able to travel and do things, it's a better mental health process. So how do we incorporate that stuff so that we can kind of tear down the stigma, but empower the people through these different things that we need to help with mental health?
I just want to comment on that quickly because I'm working with a lot of people in that arena. We have to understand that most of the studies, this, that have been done with so-called diagnosis or dual diagnosis have been done on white folks. So for our Black clinicians and psychologists, from what school are you coming from? Now, perhaps maybe a lot of them would like to take classes with us also, because we'll be able to use that example of the well-being of the physical and mental health and the process that we use for it. We understand the environment that we're in. It's already like everything was already taken away. Yet now you're taking my drawers. I'm standing here butt naked. You've ruined over 60% of our businesses. And you're talking about, well, we understand your mental health is not going to be right. But perhaps we could use those historical examples of how we worked in that basis. And I know Dr. Burt Small would love to get involved in a conversation like that in terms of how we also handle that on a medical basis on his end. So that is what is needed. From the streets all the way to the Congress seats. And we do have some great people like Barbie and other people who are with us. But the thing about it is the education needs to be given to every profession. Remember, they are lacking a lot of them, the same information. We caught professors written, I don't know what else, and there's a lot of fallacies and misnomers. And then when we get back and educate them, it's sort of even education is needed on every level for them to recognize it. This is what I want to say to the young people. We don't worry about opinions, because you tell them, you got us. We will track because we the elders and their alums happen. It's a matter of, like Steve said, Professor McCutchen said, if you want to learn and grow, you can do that. We will teach you.
He broke up on us. I think we lost him. He broke up. Jada, Jabari has a question you want to put up?
Level for them recognizing. This is what I want to say at the party here at the back. And Professor
Barbara still talking?
We can't hear him. Go ahead, Jabari, because I think he's breaking
other
up.
than that, you go to school basis on right studies, or study ain't hear me now, so go ahead.
I kind of got like a statement and a question. I want to bring up Jonathan Jackson, who we don't talk about enough. He probably would have found a cure for cancer if that's what his brother was up against. But, he was up against the system. So he put his life on the line to try to free his brother. So we see the oppression kind of interrupted the type of things that y'all was trying to do, the programs that y'all was creating, you know what I'm saying? You probably would have solved world hunger if it had not been for COINTELPRO and whatnot. But I guess my question is, we see people following the legacy today and marching through the streets with guns or whatnot, and the legacy of the Panther Party. Can y'all like pull out y'all little black book and get a bunch of nurses to come out in the streets and doctors that, black doctors that really articulate what the disease is? I got some old comrades and contacts in Cuba, that we could get helpers with this epidemic?
Saturu, you gonna take that one?
Well, basically, I was going to simply say this, is that as you notice in the video, that Sister Sheba, who was part of the health cadre, said, well, most people were so-called in the streets with the misnomer and picture of what they thought the party was about. We were creating the programs. So marching with guns and what have you was not the Black Panther Party. We never marched with guns or anything like that. But people see that decrepit image of what Sacramento and the FBI and the DIM with that aspect. But like you said, the idea is here. It's about learning. And the idea is the knowledge is here. It's like we said about the co-host. The blueprint is with this generation. You got more people, both black, young black and white, and also teaching them how everybody interacted in a class struggle. How did how did the brown community, the Native Americans, and beyond? So this is what we want to be able to do. Teach our generations here this new about what needs to be done so it can carry it on from generation to generation and even make it better than what it was before. Steve, I think you have something to say. We're almost 3:59.
No, it just goes back into what we can do from here on.
Yes.
We asked the questions about the health clinics in the era of COVID-19. We asked things about how can other tactics and things be developed, engaged. The answer, solution, often is going to be in the question that we ask.
Hey, Uncle Steve.
If we ask a question that has a set method for it, you're going to get an answer to just that. We need to be aware. We need to investigate to be sure that whatever question we ask is going to lead us towards a path that leads to solutions that are constructive, practical, and rewarding in terms of our ultimate outcomes and successes in the Black community and for other poor and oppressed people. I got you. I'm sorry.
No, I just want to say places like the NFAC, the Not Fucking Around Coalition, they think that they are carrying the ideology of the Black Panther Party, but what they're really doing is they're being agitators. Have you ever wondered why not one FBI or CIA agent has not messed with them? Yeah, you got real Panthers out here doing real things who are being messed with by Homeland Security, CIA agents, and such forth. And they're not carrying not one gun in their hand, but the guys carrying the guns in their hand, ain't nothing happening to them. And it's like they are the agitators. They are part of the problem. You know what I mean? Like they think that they're carrying on that generation, but as you know, Dr. Saturu has taught me and Eseibio and others that was only 1 year of the Panther Party where the guns and the berets were actually being used. Because after that year, you guys were not using the guns and berets, correct?
That's basically it. Again, the uniforms were tactics, strategic at that time. The position that we had in terms of arms defense was a visible statement. It was a tactic employed at that time because it was legal. It caught the attention of the community, and then once it became illegal, it shifted to things that are more palatable, even though they were slow in being introduced into the Black community and into the national and international consciousness.
I think the counterintelligence is what we need in the Black community today. You know, they always pushing for gun laws. I told everybody, if all the Black people start going to buy guns, they'll switch up the gun laws. So, counterintelligent. But we got to get close to wrapping up here. We at our 4 o'clock hour, but I know Jay.
Let me just say one thing about that. It's going to scare more people in these intelligence agencies if Black folks start running in, grabbing books, this technology, controlling this technology, passing it out, setting up food production programs, consumer production program. That's gonna scare the hell out of these agencies here, more so than a bunch of Black folks standing out there with weapons.
That's right. Now, listen, just before we end, just before we end, I want to give you guys how you can get in touch with us. One of our websites is BPP, legacykeepers.com, all lowercase, BPP, legacykeepers.com. You can go on there, sign up with email. It is off the hook right now as we begin to start our classes. And also, the second site is blackpantherpower.com. Those of you who want to get that beautiful Legacy Keeper shirt that you saw Eseibio wearing, and we have other merchandise, that is how we support our ongoing work. Very quickly, we're not getting any loans, we're not getting any grants. There was supposed to be one going to UC Berkeley 2 years ago, big deal. Trump found out about it personally, got on the phone and canceled it because it was from the federal Parks and Recreation to put a monument at UC Berkeley in honor of the Black Panther Party. So we're still
Executive
alive. They
order.
know we're here. So again, BPP legacykeepers.com. You learn a lot. And then our merchandise site, blackpantherpower.com. Go on both of them, support us, buy our merchandise so we can keep doing what we're doing. Thank you so much.
All right, we're not going to end just yet. We got a couple minutes before we close out. Rico, I want Rico to get his last word. But I would like Jada, I don't want to pass Jada because she's been waiting. Do you have any questions or anything you want to
The
say,
Queen.
Jada?
Queen
Hey,
Jada.
All right. I just wanted to comment and say, I think, Professor McCutchen, what you said about the implications that that's going to have, that COVID is going to have on our almost mental state is a very real thing. And I've been hearing this term going around in the past week, and I've been reading a few articles about, and I'm sure you all probably heard of this Zoom burnout, for example. By far, this is my favorite Zoom of the week, but it is something that is getting to us on a mental level. We as humans are not wired to sit here and look at panels of faces for hours at a time. We are just not wired that way. And so my question before I forget. So my question is actually based on the fact that when I was over in Oakland helping Eseibio on one of these past Sundays, I was looking through a binder that he had put together, and it had a lot of Black Panther literature and infographics. And one of the things that I saw, one of the posters that I saw was the Year of the Youth, and that was in 1970. So being that, was that Eseibio, that was 1970, correct? Or was it 1971?
I'm not exactly sure, but
okay. So either
I know this point talking Year of the Youth.
Yeah. So Year of the Youth. So that really interested me because I hear you all mentioning the youth so much and being a driving force. So how do you think that we can implement, I want to almost say like some support system to bring more youth into the conversation? Like that poster was really empowering to see that there was a celebration of youth and highlighting them almost. So what do you all think are ways that we can almost implement something like that again?
May I say something? Because I've been talking to Saturu about it. What we've been working on for the Legacy Keepers is trying to get into the Black student unions.
Yeah.
Black student unions are, they're the future. They're the next generation. And they would love to have classes like this and be able to be taught true, because the Black Panther history, that's Black history.
Right.
And it's not taught. Go ahead, go ahead, Pop.
And I was going to mention also is that this is what we need a concerted push in the schools. The teachers are ecstatic. They need all the help. And here's the other part of the concept. We wanted to have, once they kept these classes online, we wanted to have someone to tutor them. Someone, Jada, that looks like you, that becomes a big sister, an auntie, a mother or father, then encourage them. This is why we need you to learn this. These is a twofold concept. This is, and in the Year of the Youth, what we talked about, we had the Samuel Napier Intercommunal Institute, which I was one of the teachers at, was the prelude to the Oakland Community School, the Oakland Community Learning Center in East Oakland. So yes, we still say that. It is always the Year of the Youth for us.
Rico, you want to give out some last words before we get close to wrapping this up?
Yeah. I just want to say that I am elated that this was an amazing conversation. I know a lot of people out there have tuned in. I've been watching our Facebook. We're getting there hasn't been really not a lot of questions, just a lot of folks saying, keep it up. This is an amazing show right here. They love this show. I also would like to invite you guys to our young men's group. I don't know, a presentation, something. I don't know how we can maybe just build on it, but we have a virtual mentorship group that me and John run with all young men, and it will be important for them to get this information. 2 hours, I don't know if they can sit down for 2 hours, but but I do know that, it'll be good for them to hear this information, and we can figure it out. Eseibio, I'll be getting in contact with you and trying to figure out how me and John can do this. Also, we and John is trying to unite more youth. We're doing some work with Requity with Nate Ford. He's a guy who's doing some amazing work with youth, and he has a huge platform when it comes to young people, even doing the presentation for them. So whatever me and John can do to bring this information to our young people, because we know young people are the minds that provoke most change, we definitely 100% there to support and figure out how we can do it. So we'll be in contact and just trying to figure out how can we support this movement, because we know there's nothing new under the sun. And sometimes when you want to find solutions, it's always in the past, and we just got to dig through it to find it. So thank you guys so much. It was very informative. Definitely want you guys back for whatever series, educational series, 10-point plan, 1, 2, 3, 4, 5, 6. That's 10. That's 10. That's 10 weeks.
Listen. Actually,
John, we
you
could
guys,
book the whole show.
remember, we had 63 programs, and talking about the Oakland Community School, 1977, only school to ever win an educational award from the state legislature in California. There's a whole concept about it. So we got 63 survival programs, but the youth, the young men, and we also want to create, because we do have some sisters that are part of the legacy keepers, we also want to create something for our women. We have to, and talk about how men and women engage, because we have women leadership. Yes.
What's crazy is most of the emails that come in from the Black Panther Party legacy keepers are women. Like, it's more women than men that are actually trying to come in. So
that's why we're going to work on these young brothers.
Yes, sir. Yes, sir.
Right.
Yeah.
So Jenny, you want to say something before I close this out?
No, nothing more than thank you. This was possibly my favorite Sunday conversation by far, and I can't wait for what else we will do together.
Absolutely. That is given. Remember, you are the heirs to the legacy. And I told you, as the Muslims around the world call Oakland the imperial homeland of revolutionary change. So it belongs to you. And that's what we want to be able to do. Pass it on. Keep it lit.
All power to the people.
All power to the people. AP to the P.
Hey, it's been a plum pleasure, everybody. It's been a plum pleasure. Let's keep it going.
Let's keep it going.
So before I end, I have to say APP, all power to the people.
AP to the P.
AP to the P.
AP to the P.
AP to the P.
Hey, here's what brothers do. Here's the brothers. AP to the P, and the sisters go like this. AP to the P. So that's it right there. That's it right there. Yeah.
So yeah, before we close this out, I want to say thank you as well for you guys coming on. I mean, me and Rico, we believe in, education is the key to anything. And we need people to volunteer. And we've moved this platform on to just bring information. It's hard to get sometimes our people who become educated or have businesses to do things, volunteer for the community. So I just want to encourage all the people today just to see how these brothers showed up, that as Black people, even though we acquire knowledge and we get degrees and we run successful businesses, that we also still have to give back. So volunteering your time and giving back and educating the people is a paycheck it's priceless, right? So we just encourage people that have information. We're trying to educate our community on all levels, from health to finance to just innovation, technology. We need all the help. We have a big gap with our seniors using technology. So some of the young people who have the technology skills, we need to help bring it to the community. So I just want to say I just want to say thank you guys for coming today. It was very informative to me. I mean, being born and raised in San Francisco, the Bay Area, just to know not only the history of how we have changed the world, but just to be on here with the alumni, some of the people who walk with Huey and was a part of the change of our communities, and just implementing and getting some of this stuff back into our community is just a blessing for me, getting this information. And I'm just proud of what you guys are doing with the legacy and not letting it die and keep giving this information. And I just want to extend our hand out to you guys, anything that we could do, to help promote, get information out to our people. You guys have an open invitation to come in and share with our people, because that's what this is about. This Black media platform is to get information to our community. We don't want to hold on to the information. We want to give it. And I just love the way you guys doing it, because this is one of the biggest things that me and Rico always talking about with our churches. Sometimes our pastors, sometimes our elders, they don't pass the torch to the young people to get ahead. So just appreciating to see that the elders are passing it on to the young people to grow. I think that's one of the biggest things in the Black and brown community. When do our seniors and our elders give up, the throne and pass it down to the young people and get behind them and support them? Sometimes they give up the throne and then they don't want to have nothing to do with it. But give the information, take the lessons, take the experience, and work with the young people and help develop them. And that's what me and Rico is doing, and that's why we have this mentoring program, and we got the women's coming. It's about developing our young people. And I always tell the people, every kid is not going to go to college. Every kid is not set up for that. But education is information. As long as we give our people information, the better off we are in the future. So just want to thank you guys again. And definitely any of you guys that want to join next week, we're going to continue this health kickoff. You guys were the start of it. Next week, we have some medical professionals, some actual doctors, some Black doctors and nurses and different professionals that's going to come on, and we're going to continue the health conversation. So we're not going to stop. We're just going to keep going it. And then anything that you guys want to join on in the future as we start getting into October, close to the end of the month, we're going to have a lot of political stuff going on with voting.
You have an Instagram? You have an IG where we can follow you guys at? You guys can follow our IG?
Yeah, just hold on one second. We'll get all that information to you before we get off. But what I was trying to say was I lost my thought. But we just want to keep getting the information to our people on all perspectives as we get into this the educational voting. We're going into October. We got prostate awareness month in October. Big disease that's taking out a lot of Black men, Black colon cancer, prostate cancer. We got breast cancer awareness month in October. We got domestic violence awareness in October. So we got a lot of these topics that's going to be coming up. And I just want to say you guys are welcome to come and join and participate. Just reach out to us and we'll figure out how to get you on and get you a part of the conversation, because these conversations is needed with the elders and the young people. So just thank you guys. Everyone, you can follow us on all of our social media, both sides of the conversation. We on Instagram, Facebook, YouTube. We all over, just both sides of the conversation. Searches, we there. And just thanking you guys for coming again, man. I appreciate it.
Sounds good. Also, October is Black Panther Party History Month. It'll be celebrating the 54th year founding of the Black Panther Party. So we're with you. We're here for you. And everything we said, we meant it, because we want to be able to do that. And then you guys retire us on a Caribbean island somewhere. How's that sound? And we'll be like right on AP to the P. Keep up the good work. But seriously, yes, thank you so much for having us. And this is just the beginning of an ongoing educational concept, so that we can make sure that we do what we need to do as our community and actually take charge again. And we're here for that. So let's go forward.
Cool. Professor Steve, you have anything before we leave? Jabari, anybody want to say anything before we go out?
No, I just want to extend my congratulations and appreciation to everybody who participated. And thanks for sharing. And just appreciate the opportunity that I had something to bring to the table. I didn't have my Tabasco sauce with me, but I brought a little bit.
It was hot enough. It was hot enough.
Love you, Uncle Steve. Appreciate you, Uncle Steve.
All right, I mean.
AP to the P. I just wanted to say thank you to everybody, you know what I'm saying, Black Power. And I could be reached at UNIA ACL Panther Division at gmail.com. And I mean, this is amazing, man. Yeah, I'm speechless. I'm speechless.
Our
Make sure
Instagram is our Instagram is Black Panther Party Legacy. If you guys want to follow us, Black Panther Party Legacy.
And one more thing, if anybody is interested in putting in some community work, we do a community feed every Sunday. So you could contact anybody on the panel, and they'll tie you in. For anybody in the chat who wants to put in some work in the community, we do a community feed on Sundays.
I'll definitely have to check out with you guys on that one. I like giving back to people in need. So,
Hey, what park is that?
Mosswood Park.
Mosswood.
That's right, Mosswood Park. Okay.
All right, well, we're going to go ahead and end this. Thank everybody for tuning in. Again, we'll replay this video, share, make a watch party. We want to get this information out to the community. Thank you guys for tuning in. And like we said, next week we'll be continuing part 2 of the health. We'll have some nice medical professionals to come in and have some further conversation, and hope we get some of these brothers to come back so we can have a good dialogue. And hopefully they can incorporate some of the programs that these brothers talking about in their institution. So thank you guys for joining. We see you guys next week. Have a blessed one. Be safe out there.
All power to the people.
Peace out now.
P to the P. All right. All